Okay, how's my hair doing? How's my hair? How's my hair? I done did it. So you know what? We've all had boo boos before. Where most of us have, right? Where God forbid you break a wrist or an arm, and and then you got to get an X-ray, right? And especially if you're an athlete. If you're an athlete, whether it's pro or high school, elementary school, the more you play sports, the higher the odds are you're going to break something and you're going to need an X-ray. But you know what? Welcome to Wilson Nuke Live. I am your host, DJ Tony. I'm not a DR, I'm a DJ. So always check with the healthcare professionals because I don't know shit. Okay. However, I want to talk to you. How you doing, by the way? Doing good? You doing good? No, seriously, I'm asking you. Are you? Just tell me. Give it to the screen. Give it to me, baby. How are you doing today? I'm doing fabulous. You know why? I wake up every morning and I do the 10 gratitudes that I'm happy for. It could be something simple like I'm grateful for the sun. I'm grateful for my bed. I'm grateful for my friends. You know what I mean? You got to do that. Anyways, that's not what the show's about though. But I just want to ask you, how are you doing? Go ahead, say it to me. Okay, good. So today's show, you're getting a CT scan. That's right, a CT scan or a CAT scan. So a CT scan. It sounds pretty scary. We're going to unpack it today. We're going to help you. I'm going to help you so you're not scared. You're not crapping your pants, okay? Because it's nothing. You're going to be fine, okay? Shh, quiet. You're going to be fine. Listen to me. Listen to me. Okay, here we go. So your doctor, your GP has probably wrote the script, prescribed a CAT scan for you, a CT scan, which is basically like an X-ray. It's an X-ray on steroids. It's a X-ray that can detect a whole lot and tell doctors a whole lot about what your problem is or isn't. So that's what we're going to be talking about today. Don't forget, subscribe. Do me a favor. We're getting our ass kicked out here. We need some subscribers. Okay, so can you click down here? No, down there, and you see this little. Just click that and subscribe. You don't have to watch the show. Just subscribe. Okay, so you're getting a CAT scan, and the reason why you're getting a CAT scan is because, it could be a million different things. You got into a car accident, or you have massive back pain for months and months and months. So why are you getting this CAT scan? You might be wondering, why is the doctor, usually your GP prescribes this, and then you go off to what do you call it, radiology center to do whatever. It could be a PET scan, MRI, CT. But today we're talking about CT scan. What is it? Why are you getting it? What to expect? Okay. So I've had a CT scan done, by the way. So what is this? What is a CT scan? What is the definition of it? Well, if you look it up, it's a computed tomography. Oh, that sounds like, whoa, bro, that's you. Let's break it down. Computer. See that? Tomography. Tomography is basically a slicing of the body. It's a slicing of a photo of the X-ray, and that slicing enables doctors to take a really, really good layered, detailed look at whatever it is, your torso, an arm, a leg, a spine, the head, So that's all it is. It's computerized, layered photo, essentially. But it's an X-ray, but a super duper X-ray. And so that's that. It's very, very detailed, crystal clear, super 4K, amazing. You can see everything. Okay. So now let's talk about it gives detailed images of body parts, including bones and muscles and fat and organs and blood vessels. So that's what the CT scan does. This is why you're going to get this done. Typically, it's because, let's be honest, there might be a fear of cancer or some kind of other disease or God forbid you got into a car accident or something like that. So why is it done? It's to diagnose muscle and bone disorders such as bone tumors or fractures, pinpoint location of tumors, infections or blood clots. It also helps to guide procedures such as surgery, biopsies, or radiation therapy for a doctor. It can detect or monitor, It can detect and monitor diseases and conditions such as cancer or heart disease or lung nodules and liver masses. So that's what CT scans kind of really good at. Now, I'm not going to get into why not a PET scan or MRI or ultrasound. Those are different shows. Everything has all these types of peering into the human body. All these types of detection systems have their pros and cons, and they do certain things better than other types of X-rays or detection technologies. But so that's what the CT scan is good for. Now, moving on, one of the biggest reasons why someone would get a CT scan is people usually complain about chronic back pain or injury to the spine. That's typically why, not the only reason. Like I had a CT scan done on my heart, which had nothing to do with my back. Okay, so I think it's called a calcium score, what I had done, a cardiac CT scan, and I'm going to get into that in a second. But all right, so now you might be wondering, like I said, like, well, why wouldn't I get an MRI? An MRI is better at certain things than the CAT scan. You might hear those terms interchanged a lot, like MRI or a PT scan or an ultrasound. Again, they all have their pros and cons, and they all have their superpowers, so to speak, and their weaknesses. But that's what the CT scan is good for. Just as a little quick ancillary thing. So some cancers like prostate cancer or uterine cancer or certain type of liver cancers are pretty much invisible or very hard to detect on a CT scan. That's why you would want an MRI. Anyways, I'm not going to go in that hole. Back to CT thing. Okay, so you get in the CT scan. Now, what to expect when you're going in? If you never had this before, you're probably shitting your pants, and it's it's easy because all the nurses and doctors and people, oh yeah, it's easy. It's easy for them because they're not in the fucking thing doing it, right? But honestly, it's easy. You're not going to feel anything. This is what you can expect. Nothing. You're going to lay there. You're either going to be put in some type of tubing or overhead thingy that scans you. I don't even think they even do this long tunnel tubing anymore thingy. Maybe they do. But when I had my cardiac CT scan, it was like this half moon thing came over my body and then it just went back down. And that was it. Like there's no prep. Now some CT scans might take prep if they're going to inject you with some kind of dye and all that jazz. But I'm talking about just the scan only. So you can expect about 10-15 minutes, not counting prep and all that. Prep meaning like you might get undressed or something like that, or put a gown on. I don't know. That's about it. Like, so there's no pain. There's zero pain. You're going to lay on a table and they're going to have this arm or machine thing come over you and that's it. They're not going to crunch you. It's not like mammography where they're squashing your titties, none of that stuff. This is just, like a wand almost comes over you and that's it. And then you hear some clicking and there'll be a tech outside the door or they'll come back in maybe and check, whatever. That's what you can expect. And it's about a 10-15 minute thing, depending on, I guess, what body part they're doing. For me, it was the cardiac CT scan. I went because I was complaining about chest pains for not one day. I was complaining about chest pains for a while, and it was like mimicking heart problems, pain in the chest, up in the neck, and this and that. And so that's one of the best ways to detect. There's other ways, but there's one of the golden standards for detecting any kind of heart disease is a calcium CT score. So that looks at the arteries and the heart, and again, a very, very layered, very detailed way. They found that everything is okay with me, and I'm just an asshole. So I was like, all right, fine, cool, that's that. But anyways, yeah. So there's no pain. That's what you can expect, and for any part of the body that's going to have a CT scan. The upside, like I said, a lot of upside. You can see everything in detail. It's like literally a doctor or the tech is just peering right through your body or into your body. It is an amazing piece of technology that has saved and is saving and will save millions and millions of people's lives, because again, we have X-ray vision essentially. There's only one downside, and it's a downside. I wouldn't say it's a massive downside, but it's a downside. You're exposing your body to massive dose radiation. Why is that a downside? Because the scan can increase your chances of cancer. I'm not saying it's going to give you cancer, but because you were bombarding your body or body part with a high dose radiation is bad for the body, period. So it's cost benefit analysis. You wouldn't be getting a CT scan for fun. I kind of marvel sometimes when people are getting CT scans for their dental exams. I'm like, okay, why would you do that? I understand the upside is much more detailed photo, but you're bombarding your head with massive dose radiation for what? You could just get a regular X-ray or just poke around with the dental poker, and if it hurts, cavity. You know what I mean? I don't know. But in my case, I thought it's probably good to get it because I was having really a lot of chest pains and stuff, and it just turns out I'm very gassy. I don't eat and chew my food as good as I could, and all this stuff. I chew my mouth open, blah 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 blah, which can mimic, heart problems when there's no heart problem because the gas is in the anyways, long story. Okay, so but I'm fine. So that'd be the only downside is you're exposing yourself to high dose radiation. So you really have to talk to your healthcare professional and say, look, pros and cons, cost benefit analysis, return on investment here, folks. So that's basically that. Okay, what else about the CT scan that you should know if you're going to be getting one? Cost, I mean, I don't know. It depends what it costs. Depends on how your insurance is and all that jazz. What else? What else do we want to know about CT scans? Yeah, I mean, if you're getting a CT scan, you're probably getting it because it's, you're worried about something serious, and thank God for CT scans, though, because, I mean, 100 years ago, 50 years ago, didn't exist. And, a lot of people died because they didn't have this technology to really peer into the human body like we can. So that's basically that. Like I said, CT scan doesn't show everything, as I alluded to before, with certain types of cancers and stuff. Interesting thing about cancers or tumors, when a doctor opens up a human body to remove a tumor is almost invisible. So think about that. Like if a doctor is going to remove a tumor from somewhere in the body, just looking at the hole they made or looking through the camera, the laparoscopic surgery, whatever it is, the tumor blends into its surroundings. It's not like it's wearing a pink hat and pom-poms saying, I'm a tumor. So like, yeah, you need, but they have technologies. Like I said, the MRI can detect something like that. And I believe there are some firms out there in the world that are working on making a tumor glow. So they would inject the patient prior, and then when a doctor does open up a patient or go in, with minimal invasive surgery, the tumor is glowing green. That's amazing, because then okay, I know where we have to go. It's a lot less problem to try to pinpoint it when it's in the body, because anyways, we're getting off topic. But so that's the CT scan. You could always get second opinions if you're worried or whatever. What else? Yeah, this scan's 15 minutes. Yeah, when would you get your results? Depends on the hospital or medical place you're going to. Some places will give you your results like right away, same day. Some it might take a day or two. I know, obviously you want to get your results boom right then and there, and we all do, right? But yeah, I mean, it's, I guess the longest you're going to wait is maybe a few days. I know it sucks, and maybe the shortest you would wait is like right there after they're done. They might just be like, yeah, you're good. So, but don't. If you and your doctor or doctors determine that you really need this, please go get it, because the CT scan is there to help you. It's not going to give you a problem. You know what I mean? Like if you don't get this done, and if it's deemed you need it, and you don't get it done because you're afraid of bad news, well, the bad news is either already in you or not. Like the scan's not, giving you the tumor. You know what I mean? So again, check with healthcare professionals. But it's a zero pain, nothing. So you can't be like, oh, I'm afraid of pain. Like there's nothing. It's just like they're waving a wand over you, literally. All right. So I want the best for you. We deserve the best. Our bodies are Ferraris. We treat our Ferraris with respect, and we give the best fuel, the best medical attention, the best we can do. You deserve the best. I'm proud of you. You can do it. Do it if you have to, and everything's going to be working out. Just do what you got to do. Follow the professionals, and you're going to be fine. Don't worry. If there is something, then they're going to take care of it. It's going to work out. And if there's nothing, cool. Now you have peace of mind, right? You know what I'm saying? So you deserve the best. I want the best for you. Anyways, that is it. Don't forget, subscribe. All right, guys, thank you. And check back in, because we're going to talk about MRI. We're going to talk about PET scan. We're going to talk about ultrasound. We're going to talk about just the old regular X-ray, mammography, all this stuff. So, all right, thanks, everybody. 5, 4, 3, 2.